If you will take your seats, we will begin. I'd like to ask all of our guests today to please take their seats. Subcommittee will come to order. The chair will recognize himself for an opening statement. Today's Health Subcommittee hearing will examine the World Trade Center, WTC Health Program, that was created in the James Zadroga 9/11 Health and Compensation Act, enacted in 2011. The Act allocated $4.2 billion to create the health program, which provides monitoring, testing, and treatment for people who worked in response and recovery operations, as well as for other survivors of the 9/11 attacks. The authorization of the health program ends on September 30, 2015. Another part of the law, the September 11th Victim Compensation Fund, is under the jurisdiction of the Judiciary Committee. It will continue to accept applications until October 3rd, 2016, over a year after the health program authorization ends. The WTC Health Program funds networks of specialized medical programs, and these programs are designed to monitor and treat those with 9/11 related conditions. For responders, the World Trade Center Medical Monitoring and Treatment Program. For survivors, the NYC Health and Hospitals Corporation WTC Environmental Health Center. For NYFD personnel, the Fire Department of New York Responder Health Program. The national program, the WTC Health Program, has a nationwide network of clinics with providers across the country for responders and survivors who live outside the New York City metropolitan area. These programs provide free medical services by healthcare professionals who specialize in 9/11 related conditions. Our colleagues, Representatives Carolyn Maloney, Peter King, and Gerald Nadler, have jointly introduced legislation, H.R. 1786, the James Zadroga 9/11 Health and Compensation Reauthorization Act, which reauthorizes the Act. This legislation has begun an important conversation that will lead to a timely and fully offset reauthorization of the health program. Today's hearing will allow us to learn more about how the program is working and whether changes are needed. We will hear from the Director of the National Institute for Occupational Safety and Health, who is responsible for administering the program, as well as from the Medical Director of the Robert Wood Johnson Medical School and two first responders who are enrolled in the World Trade Center Health Program. I look forward to the testimony today, and I would like to yield the balance of my time to the gentleman from New Jersey, Representative Lance.
Thank you, Mr. Chairman. It is my honor to welcome David Howley, a constituent of mine in New Jersey's 7th Congressional District, to the committee this morning. David, thank you for making the trip from New Jersey to share your story and advocate for those who cannot be with us today. We look forward to your testimony. I first met David several months ago when he came into my office in Westfield, New Jersey, to discuss the bill before us today. And this Reauthorization Act is, I think, critically important. David has been a tremendous advocate for the legislation because, as he will detail in his testimony, he knows firsthand the importance of these programs for him and his fellow first responders and survivors. David joined the New York Police Department in 1985 and served in various departments over his 20-year tenure. He is a third-generation law enforcement official, following the tradition of his father and grandfather. He was serving in the NYPD Operations Division on September 11, 2001, and spent the next several months in the dust and rubble of Ground Zero. I'm proud to have David here with us today, and I'm proud to be a co-sponsor of this critical legislation. It is my hope, Mr. Chairman, that we can work in a bipartisan fashion to move this legislation forward quickly, and I look forward to voting for it not only here and in full committee, but on the floor of the House of Representatives. Mr. Chairman, I yield back the balance of my time.
Chair, thanks to gentlemen, and I also would note that some of our colleagues from the New York delegation who are not on the committee but very concerned of this issue and sponsors of the legislation have requested to sit on the dais, and we welcome them this morning. At this point, the Chair recognizes the ranking member of the subcommittee, Mr. Green, 5 minutes for opening statement.
Thank you, Mr. Chairman, for holding a hearing on this important program. I thank the witnesses today and to the first responders in the audience who, for their bravery and service both on and after the tragic day of 9/11. Thank you for coming today to share your personal experiences, the committee, and shed light on the significance of the World Trade Center health programs. No one here can forget the horrific attacks perpetrated upon our country at the World Trade Center in New York, the Pentagon in Washington, and at the field in Shanksville, Pennsylvania. During and after the attacks, tens of thousands of first responders, including police, firefighters, emergency medical workers, jumped into action to assist in rescue, recovery, and cleanup. As a result of their service, these responders were exposed to dust, smoke, toxins such as pulverized concrete, fibrosis glass, particulate matter, and asbestos. This exposure caused many of them to develop a spectrum of debilitating diseases, including respiratory disorders like asthma, skin, prostate, and lymphedema cancers. A GAO report on the 9/11 health program suggested that firefighters who responded to the attack, quote, experienced a decline in lung function equivalent to that of which produced by 12 years of aging. In addition to the physical ailments these heroes now have, many have suffered post-traumatic stress syndrome, PTSD, depression, anxiety stemming from psychological trauma they experienced in the aftermath of the attack. Nearly 1 decade after the September 11 terrorist attacks, the James Zadroga 9/11 Health and Compensation Act was signed into law in 2010. The Zadroga Act created the World Trade Center health program within the Department of Health and Human Services. The program provided evaluation, monitoring, and medical necessary physical and mental health treatments to first responders and certified eligible survivors of the World Trade Center related illnesses. It's also established a network of clinical centers of excellence and data centers. For these responders and survivors who reside outside the New York area, the Act created a national network of health providers who provide the same types of services for World Trade Center related illnesses. While cancer was not originally listed among the statutory WTC related health conditions, 60 types of cancer were added in 2012 after a petition by members of Congress. As of May the 5th of this year, 3,700 members of the health program had cancer. The Act also established a Victims' Compensation Fund that provides compensation for harm suffered as a result of debris removal. Without action by Congress, funding for the current health program will terminate on September of 2016. The James Zadroga 9/11 Health and Compensation Reauthorization will reauthorize the critical World Trade Center health program and the Victims' Compensation Fund. As required under the current program, New York City will continue to pay 10% of the total cost. It's important to note that the WTC health program serves our heroes nationwide and extends far beyond New York area. Both these and currently enrolled and future enrollees live in all areas of the country. In fact, as of August 2014, 429 of the 435 congressional districts were home to at least one 9/11 responder or survivor. We must not abandon those who were bravely sacrificed their own well-being in behalf of the country in the wake of terrible attacks. We have a duty to serve our first responders and survivors and heroes with complex health care from 9/11. It's critically important that we support the James Zadroga 9/11 Health Compensation Reauthorization Act. I'd like to thank the first responders for their gallant and selfless service on and after 9/11. I'd also like to thank the doctors and administrators of the program for their efforts to treat the complex illnesses afflicted on our first responders and continue research on the impact of exposure to toxins and psychological trauma. Mr. Chairman, if someone on our side of the aisle would like a minute, I'd be glad to yield to them. I'd like to yield to my colleague from New York.
I thank the ranking member of the subcommittee as well as the chairman and welcome our witnesses here today. While not a member of this subcommittee, I am a member of the full committee on energy and commerce. I'm Congresswoman Clark of New York. And I wanted to thank Chairman Pence and Ranking Member Green for holding this hearing and allowing me to sit in this very important hearing. Also, I want to thank our panelists. It's good that you have shared your experiences and remind America of the importance of renewing this very important program. This is a great first step toward reauthorization. In a time when the American people are skeptical about the work of Congress, I'm happy that this committee is working in a bipartisan fashion to move expeditiously to renew these important health programs. Congress must move forward to ensure first responders and survivors of the 9/11 terrorist attacks on the World Trade Center, the Pentagon, and Shanksville, Pennsylvania, continue to receive the care they deserve and they so sorely need. With that, Mr. Chairman, Mr. Ranking Member, I yield back the time.
Mr. Chairman, I yield back.
Chair, thanks to gentlemen. Now recognize the chair of the full committee, gentleman, Mr. Upton, 5 minutes for an opening statement.
Well, thank you, Mr. Chairman. Back on September 11th, 01, the world as we knew it was turned upside down by the unthinkable acts of terrorism, which took the lives of nearly 3,000 individuals in New York, Pennsylvania, and Virginia, left a mark on every American. Every one of us was impacted. From the smoldering ruins of the Twin Towers and the Pentagon to the wreckage of United Airlines Flight 93, the painful images and heartbreaking personal stories of that day, every minute, will not be forgotten. We remember the thousands of innocent lives lost and the communities of loved ones that they left behind, and many of us met with those. We also honor the countless acts of heroism and leadership shown by the brave American men and women in those hours of pandemonium and in the days, weeks, months, and now years that have followed. Then, for me, as chair of the Telco Subcommittee on this committee, I led a bipartisan delegation both to New York and to the Pentagon, where we witnessed firsthand the valiant efforts of our first responders who were certainly exhausted, overwhelmed, but still working 24/7. First responders spent hours, days in the air that was thick with dust and smoke, digging through the rubble, searching for survivors. When I visited Ground Zero, New York's finest were still working round the clock in impossible conditions for the recovery efforts. Their selfless work took a toll on their health. We know that. The federal government provided aid to those individuals who were injured and the families of those who were killed in the attacks through a discretionary grant program, as we should. In 2011, the Zadroga 9/11 Health and Compensation Act established the World Trade Center Health Program and the Victim Compensation Fund. Our ranking member, Frank Pallone, and our New York colleagues, Representative Carolyn Maloney, Peter King, Jerry Nadler, have jointly introduced now H.R. 1786, the James Zadroga 9/11 Health and Compensation Reauthorization Act, which would reauthorize both of these programs. In today's hearing, we're going to focus on the World Trade Center Health Program, as it is the program that falls in this committee's jurisdiction. The authorization for the World Trade Center Health Program ends at the end of September, just a few months from now, while the Victims' Compensation Fund remains open to applicants into October of 2016. The WTC Health Program funds networks of specialized medical programs designed to monitor and treat those with 9/11 related conditions. The members enrolled in the program are not just from the greater New York area. In 2014, there were 71,942 individuals in the World Trade Center Health Program from 429 of the 435 congressional districts. In fact, there are 75 Michigan residents currently enrolled in the WTC Health Program. Today's hearing is, yes, an important opportunity to learn more about how the World Trade Center Health Program has operated since its authorization in 2010 and what is needed for it to successfully operate and meet the needs of its members in the future. I want to thank all of the witnesses today for taking the time to be here, especially thank Officer Howley and Detective Burnett for their service to our great country, for sharing their personal stories and struggles with this subcommittee. The bill needs to be passed, and I will look to consider every effort to make sure that we get it to the House floor prior to the end of September, so that we'll have an opportunity to make sure that these victims are taken care of. And I yield back the balance of my time.
Chair, thanks, gentlemen. And now, Chair is pleased to recognize the ranking member of the full committee, gentleman who has many constituents impacted by this issue. Mr. Pallone, 5 minutes for an opening statement.
Thank you, Chairman Pitts, and also Chairman Upton. And I particularly want to thank Chairman Upton for the comments he just made, highlighting how we need to perceive this as a national program and impacting people who came and helped out on 9/11 and the aftermath from all parts of the country. My staff probably is tired of my telling the story, but I remember within a few days after the attack, we went up to New York City with President Bush, and I was standing next to this big yellow fire engine that said Hialeah, Florida. And I said, what is this truck doing from Hialeah? Because I think it was only 1 or 2 days after. And I wondered how it even got there so quickly. And I talked to the firemen from Hialeah, Florida, and they said, as soon as this happened, we just got in our fire truck and we drove up from Florida because we wanted to help. And it just struck me at the time about how so many people responded from all over the country, and so many people were injured because of the fact that they were there for a few days or a few weeks or a few months even. So this bill is a critical first step in ensuring that the 9/11 health program is extended as soon as possible. As you both already know, this is one of my top priorities for 2015, and I'm grateful for Chairman Pitts and Upton for your willingness to work with us to ensure the timely passage of this bill. I have to recognize all the first responders who are here and to whom we owe a debt of gratitude. I also want to acknowledge Dr. Iris Udison, who runs the New Jersey 9/11 Health Clinic. Thank you for being here to share your expertise and experience with us today. And let me also mention all the New Yorkers, Representative Maloney, the sponsor of the bill. I don't know if Representative Nadler is here, but certainly he's been involved from the beginning. Representative King, I see, who joined the committee today, as well as our representatives, Yvette Clark, Elliot Engel, and also my colleague from New Jersey, Leonard Lance, who's a co-sponsor. Since day one, you've all fought tirelessly to ensure that our nation's 9/11 responders and survivors are cared for, and I'm proud to fight alongside you. Beyond the immediate loss of life of 9/11, we now know with great documentation that thousands of first responders and survivors of the attacks are now suffering debilitating illnesses from its aftermath. In fact, more than 100 firefighters and 50 law enforcement officers have reportedly lost their lives to WTC-related health conditions. Additionally, more than 1,500 active-duty firefighters and EMS personnel and over 550 law enforcement officers were forced to retire due to WTC-related health conditions. We now have a deep understanding of how the tons of dust, glass fragments, and other toxins released into the air affected both responders and survivors. Illnesses include respiratory diseases, gastroesophageal disorders, mental health conditions, and cancer. And that's why the James Zadroga 9/11 Health and Compensation Act, signed into law in 2011, is so critical. It established a program to monitor and screen eligible responders and survivors and provides medical treatment to those who are suffering from World Trade Center-related diseases. But what is so important to note is that this program isn't there to provide health insurance. These are complicated conditions that are chronic in nature and require special expertise to appropriately diagnose and treat. That is why the program includes a network of clinics and providers specifically trained to treat these diseases. It also ensures that providers and survivors bear no out-of-pocket costs associated with these particular health conditions. The WTC Health Program currently provides monitoring and treatment services for more than 71,000 responders and survivors. They reside in every state and in 429 of the 435 congressional districts. If some of you don't know, the law is named for James Zadroga, a New Jersey hero who responded on 9/11 and spent hundreds of hours digging through World Trade Center debris. Mr. Zadroga died in 2006 from pulmonary disease and respiratory failure after his exposure to toxic dust at the World Trade Center site. Like him, thousands of people from all over this country came to the aid of our country and helped others at Ground Zero. Those responders and survivors should not be abandoned, and I hope we can extend the health program without delay. I only have 30 seconds left for Mr. Engel. I apologize, but I yield to him.
Well, thank you. I thank the gentleman for yielding, and let me agree with everything you said. In the aftermath of September 11th, it's estimated that up to 400,000 Americans were exposed to copious amounts of smoke and toxic substances such as asbestos, and as a result, many of our heroes now suffer from these debilitating conditions. Acute respiratory disorders, cancer, depression, post-traumatic stress disorder, and it goes on, and it's heartbreaking that the 9/11 survivors and first responders who have already given so much must now carry the burdens of these long ailments bring. The very least we can do in thanks is to help them. So I was proud to be an original co-sponsor of the James Zadroga 9/11 Health and Compensation Act, and I'm proud to be an original co-sponsor of the reauthorization we're discussing today. A failure on Congress's part to pass this vital legislation would constitute an egregious affront to the Americans who gave so much on 9/11. Service to their country, and I specifically say Americans because the population of those who will benefit from this reauthorization spans the entire United States. It's 429 of the 435 congressional districts benefit from these programs. So this is an issue of national performance. So the first responders who rely on the World Trade Center health program did not hesitate to risk their lives for fellow Americans on 9/11, and we should not hesitate to care for them now. So it's critical importance that we permanently reauthorize the James Zadroga 9/11 Health and Compensation Act. Thank you, Mr. Pallone. Thank you, Mr. Chairman.
Chairs, thanks, gentlemen. And as usual, all members' opening statements, written opening statements, will be made part of the record. That concludes our time for opening statement. I have a unanimous consent request. I'd like to submit the following documents for the record. Statements from Representative Peter King, New York 2nd District, from the International Association of Firefighters, from the Sergeants Benevolent Association, from the National Association of Police Organizations, and an article from the New York City's Patrolmen's Benevolent Association featuring Mr. David Howley. Without objection, so ordered. We have two panels today. On our first panel, we have Dr. John Howard, Director, National Institute for Occupational Safety and Health, NIOSH. Thank you very much for coming today. Dr. Howard, your written statement will be made part of the record. You'll be recognized for 5 minutes to make your opening statement. At this time, you're recognized. Welcome.
Thank you, Mr. Chairman and distinguished members of the committee. My name is John Howard, and I am the administrator of the World Trade Center Health Program. I'm very pleased to appear before you today to discuss the program and those it serves who responded to or survived the September 11, 2001 terrorist attacks on New York City, and those who responded at the Pentagon and in Shanksville, Pennsylvania. The program's members responded to an epic disaster, and as a result suffer mental and physical injury, illness, and the risk of premature death. The program's members responded to the 9/11 disaster from all 50 states, and it has been stated, from 429 of the 435 congressional districts. The original effort to care for those affected by 9/11 toxic exposures operated as a series of cooperative agreements and grants. As a discretionarily funded program, it depended on year-to-year appropriations, making it challenging to plan adequately for the members' ongoing health needs. In January 2011, as has been stated, the James Zadroga 9/11 Health and Compensation Act became law. Stabilization of funding allows the program to more adequately care for 9/11 responders. In calendar year 2014, of the 71,942 current members enrolled in the program, 20,883 members received treatment for health conditions arising from hazardous exposures from 9/11, and 28,059 members received health monitoring to ensure early medical intervention for any developing health condition that is specified for coverage by the program. Since the program's implementation, members have been treated for a number of different health conditions. For example, 11,473 members have been treated for asthma, 6,672 members have been treated for post-traumatic stress disorder, and 6,497 members have been treated for chronic respiratory disorders. The majority of our members suffer from multiple mental and physical health conditions and take multiple medications for these conditions. Certain types of cancer were added to the list of health conditions covered by the program in late 2012. Since then, the program has certified 4,265 cases of cancer. The World Trade Center Health Program fills a unique need in the lives of our members and for our society. First, members are evaluated and treated by medical providers who have a depth of experience dating back to September 11, 2001, and the physical and mental health needs of 9/11 responders and survivors they are very familiar with. Their extensive clinical experience with the responder and survivor populations, as well as their understanding of the role of exposure in causing disease, exceeds the training of providers unfamiliar with the types of exposures and health conditions common to the 9/11 population, and how to make the connection between exposure and illness that the Zadroga Act requires. Second, our members are receiving health care that cannot be provided or only provided with great difficulty by other types of insurance plans. For example, health insurance plans do not routinely cover work-related health conditions, leaving such coverage to workers' compensation insurance. However, worker compensation insurance often presents coverage challenges to members because their 9/11 health conditions often first manifest after 9/11 many years later, beyond the statute of limitations found in most state worker compensation laws. The World Trade Center Health Program serves a vital role in overcoming the difficulties that members might otherwise experience in its absence. Without the program, 9/11 responders and survivors might end up in limbo instead of in treatment. Third, by providing evaluation and treatment for those most affected by 9/11 as a unified cohort, the program greatly aids not only the individual members, but also our national understanding of the long-term health effects of 9/11, including its effects on children. The program helps us better prepare for the medical needs arising from large-scale, long-duration disasters that might not, hopefully, occur ever in the future. Thank you for the opportunity to testify, and I'm happy to answer any questions you may have.
Chair thanks the gentleman, and I will begin the questioning and recognize myself 5 minutes for that purpose. Dr. Howard, would you continue to elaborate a little bit on the history of the World Trade Center Health Program, how it came to be, how it has changed over time?
Thank you. The program started as a immediate response to what doctors were seeing, especially with the New York City Fire Department, in what was called at that time a World Trade Center cough. And those doctors and others that were recruited to the effort began to observe that individuals who were responding were becoming ill from inhalation of the dust and the toxins contained in the dust. So immediately, through FEMA appropriations, CDC and then the National Institute for Occupational Safety and Health was able to offer grants and cooperative agreements so that those doctors could begin now, many years later, their first work in trying to articulate, characterize the issues that responders were facing and survivors.
Another question, what are the consequences of letting the World Trade Center Health Program expire in September of 2015? How would it affect the operation of the centers of excellence across the country and the patients who use these facilities and services?
Certainly, any of us that receive health care from a particular health plan, if we're notified that that plan no longer exists, creates great stress in our life. We have to adjust to new providers and other changes. Our efforts to help those who may be part of our discontinued program, let's hope that does not happen, would have to receive other providers of care, and it would be our responsibility to make sure they did. The Centers of Excellence would not operate anymore as a coordinated care operation for responders and survivors.
Thank you. Now, we're aware that Special Master Sheila Birnbaum administers the Victim Compensation Fund, which is housed at the Department of Justice. Is there coordination between the operations of the Victims Compensation Fund and the World Trade Center Health Program?
Yes, sir, there is. We have data sharing and medical review agreements with the Victims Compensation Fund. We regularly meet with the staff. Our staff is embedded with their staff to assist in the medical review. The Victims Compensation Fund has adopted our program requirements for their medical review. To date, we have provided information to them on 18,262 of their VCF claimants. We continue to work very closely with the Victims Compensation Fund.
How much higher is the Federal Employees Compensation Act, FECA, compensation rate compared to Medicare Parts A and B reimbursements for hospitals?
The statute, the Zadroga Act, sets the reimbursement rate according to the workers' compensation rates of the federal government, the FECA rates. Medicare rates are lower, but maybe by 10 to 20% lower. So they are the FECA rates are higher, and our reimbursement rates for providers are higher than Medicare.
Dr. Howard, I can imagine that it is a logistical challenge to provide care for the responders and survivors who are scattered all across the country. What can you do to ensure that a physician in another part of the country seeing only a few World Trade Center patients benefits from the clinical experience of the physicians in the New York metropolitan region who have more experience treating these WTC-related health conditions?
The nationwide provider network that we have, which is currently seeing about 8,287 individuals, we have total coordination with that provider network. On the one hand, all of those individuals who do monitoring for our survivors and responders that are in the nationwide program are trained, occupationally trained physicians, so that they are equivalent to the physicians that we have in our centers of excellence in New York and New Jersey. We also provide them with additional training. We are working with Medscape right now to have online training available for all of our providers. We work with our contractor, LHI, which has the nationwide provider network, and that physician, their medical director, sits in all of our groups and committees, and we engage actively with those physicians. So I would say that for our relationship with the nationwide provider network, those physicians are on par with our physicians at the CCEs.
Good. Thank you very much. My time's expired. Chair now recognizes the ranking member of the subcommittee, Mr. Green, 5 minutes for questions.
Dr. Howard, prior to the passage of the James Zadroga 9/11 Health Compensation Act of 2010, you administered the CDC grant program that funded medical monitoring and treatment services for 9/11 survivors and responders. That program was funded through discretionary dollars, and there was always uncertainty about whether and what amount of discretionary funding would be appropriated for the grant program. Dr. Howard, can you describe how the creation of the World Trade Center Healthcare Program through the Zadroga Act has improved your ability to ensure that responders and survivors get the quality medical services that they need?
Thank you. I would respond in two ways. One, on behalf of the members, it's very stressful to constantly be told on a year-by-year basis that your care may go away. Your doctor and the institution, the facility that you go to may change. So it created a pervasive sense of stress. Mind you, in our population, we have many thousands of individuals that suffer from PTSD, and some highly resistant PTSD, and I'm sure that if they were here with me, they would say how stressful year-by-year funding is to the program. From the administrative perspective, it's very difficult because we were always up to the last minute thinking, should we start preparing for the program not to be funded, and that was certainly something that we did not want to happen, but it requires a long process of preparation. So we were never sure about that.
So the dedicated mandatory fundings helps you not only plan better, but also the reaction from the patients.
It's like night and day. When the Zadroga Act passed, I think all of us, members and us that were administrating the program, breathed a sigh of relief that we had 5 years. We never had that before.
Okay. The James Zadroga 9/11 health compensation reauthorization that would permanently extend the program. Could you explain how a permanent extension of the program would ensure that responders and survivors have that peace of mind you talked about, that medical monitoring and treatments that they come to rely on will continue to meet their needs?
Well, as I say, I think that the assurance of having the same provider, especially for our patients that suffer from very serious mental and physical conditions, is a peace of mind that can only be bought from mandatory funding without an end date. For us in the program, it really helps us do long-term strategic planning. It's very hard to do contracts when you can only provide a year or two or 5 years. But being able to look beyond that 5-year horizon is extremely helpful for the efficiency and the integrity of the program.
It seems the patients enjoy a great deal of understanding from the providers, the doctors and providers in the program. How do you think this affects the patient outcomes?
Oh, without doubt. The providers that I first met in August of 2002, when I became first involved in this program, are the very same providers that I see now in June of 2015. Their dedication to this population has been worthy of note.
So the doctor-patient relation is important because of the continuation of the program.
The trust that our members have to the providers that we are fortunate to have cannot be duplicated anywhere else.
Do you think the continuing the program is so important to ensuring the same level of knowledge and expertise?
Very definitely. Our providers have a wealth of clinical information that other providers would take them years to develop.
Okay. Thank you, Mr. Chairman. I yield back my time.
Chair, thanks, the gentleman. Now recognize the Vice Chairman of the Subcommittee, gentleman from Kentucky, Mr. Guthrie. 5 minutes for questions.
Thank you, Mr. Chairman. Thank you, Dr. Howard, for being here. And I spent, I guess, 6 years of my life in college and grad school in Metro New York. And one of my favorite things to do back when I was an undergrad, I could use the USO and spend a lot of time at the USO off Times Square. And there was always uniformed public servants there, and it was always enjoyed getting to know and talk to my talker. So I'd engage with them, and what a great service that people pull. You hit something that actually I wasn't going to go this direction, but I think it's important to talk about, and it's opened my eyes a little bit. What you said, I'll kind of emphasize or maybe go a little further. You know, I live in Bowling Green, Kentucky, so we take care of our servants as well. So if there's a fire and someone goes into a firehouse and they get injured or whatever, you know, we have systems in place, disability insurance and so forth. And so I think a lot of us that aren't, you know, in New York continuously in the surrounding areas, like some of my friends here, is that, you know, are the programs already in place? And so what you've hit on today is probably the first time I've thought of it. I know it's unique in the massness of it, but why is it unique in terms of other injuries that people might receive that requires its own system other than just the volume? But so could you hit the challenges, because you've opened my eyes to some things today, hit the challenges that you've already kind of said, but emphasize why this is completely unique, that needs its own program, why diseases are different than if you were in a normal, or I don't know if normal is the right word, but a more standard, I guess, kind of situation that firefighters or other people would be in.
Be happy to. And I think the best way to answer that question is by looking at some of the findings that we have gotten from the investment that the Act has allowed us to make in research, looking at this population and the conditions. And I'll just mention a few issues. On the mental health issue, we have seen a delayed onset of PTSD. Now, that's not normally seen in other types of situations. That's something that we're seeing in this population. We've also seen a worsening of PTSD despite conventional treatments. So that is something that's new in this population. In terms of respiratory disease, we're seeing a onset of obstructive airways disease beyond 5 years after exposure. We're also seeing bronchial hyperreactivity persist over a decade, and that's something new. In terms of asthma, we have seen patients in our program who have asthma who have lost full-time employment because of their asthma more than we've seen in the general asthmatic population. So there are a number of findings that we're seeing from a clinical perspective in this population that we would never have learned had we not had the group together.
If it was just normal workers' comp or other things. And so I want to get to another thing. So you said there's 71,000 people in the program. How do you, what's the criteria? Did you have to be on site for so many days, or, I mean,
well,
or did you have to actually be in the rubble, or you
the simple
walked away,
is,
or, I mean, what's the situation?
Yeah, the simple answer is that the Zadroga Act is highly specific about the criteria for eligibility in the program. And it includes, let's say, for New York City police officers, location, the duration of their exposure, and other factors. So eligibility criteria are pretty well spelled out in the Act.
What about the non-public safety personnel who can be in the program?
Right. There are criteria for eligibility for volunteers that came from all over the country to volunteer as responders. Similarly, in the section of the Act that has to do with survivors, there are 5 levels of eligibility requirements for survivors. So if someone comes to our program, wants to be a member, the first step is filling out an application in which a lengthy application, unfortunately, I might add, in which all of that information is solicited so that we can establish whether or not their experience meets the eligibility requirements of the Act.
And I think some concerns, as we debated before, and I just want to emphasize this, isn't anywhere in terms of health care and people getting the care or whatever deserve. I remember asking the question, why such a separate, unique program? And you've given me some really good things to think about, so I really appreciate it very much. Appreciate it, and I yield back.
Thank you.
Chair thanks the gentleman, and now recognize the ranking member of the full committee, Mr. Plone, 5 minutes for questions.
Thank you, Mr. Chairman. Dr. Howard, the World Trade Center Health Program relies on clinical centers of excellence to provide most of the monitoring and medical care through the program, and those centers employ clinicians that have both a specialized knowledge base and deep experience in treating the unique physical and mental health needs of 9/11 responders. And I know you've already talked about this. I'm kind of following up on what Mr. Guthrie said. I know that patients in the New York City metropolitan region continue to see their personal physicians for their general health care needs, but often obtain monitoring and treatment services for their conditions at these centers. And I also understand that, if somebody's in another part of the country, they can go to a network of doctors that are provided through the program. But some of them also come to the centers. I know that at the New Jersey centers, we get people from all over the country that will travel just because of the expertise that exists. So if you could just comment on the treatment benefits of individuals using these centers rather than their personal physicians for their 9/11 related health conditions, or even traveling when they can see someone who's part of the WTC network. They come to the centers.
Yes, I'd be happy to. And I think it boils down to the difference in physicians in terms of their expertise, as you said. Occupational and environmental physicians who are schooled in that particular subspecialty know how to connect an exposure with a health condition. When I went to medical school, I did not learn that. I learned how to take care of a health condition. I didn't learn to go back and do an extensive history to try to figure out what were your exposures and was that exposure related to this health condition that I see. That's a specialty of occupational and environmental medicine where we try to correlate the exposure and the health condition. So physicians that we use both in the CCEs that have been involved since 2001 and in the nationwide provider network have that capability. Physicians that don't have that capability would not be able to listen to the patient's symptoms and be able to say, yes, your exposure, I'm going to make a determination that your exposure caused that health condition or contributed to that health condition or aggravated that health condition.
I'm trying to speed up here because I wanted to ask you a few more things. Have there been any problems with misdiagnosis or improper treatment of 9/11 related health conditions when individuals have relied on their personal physicians?
Not that I'm aware of.
Okay.
Within the program, of course, we have quality assurance where we look at all of the care that's...
Okay. And can you just discuss briefly how the Clinical Centers of Excellence coordinated the care delivered to responders and survivors at the centers with care delivered by their personal medical providers outside the centers? Briefly.
Sure. As many of you know, the World Trade Center Health Program is a hybrid program. It is not your normal health plan where you go in and everything that you may complain about relative to your body, a physician takes care of. We have limited number of conditions, so many conditions we don't cover, so you have to see an additional physician, your personal physician. So that coordination is done in the CCEs so that if those CCE physicians see a condition that we do not cover, then appropriate referral is made.
Okay. Now I'm going to try to summarize this last question. My concern obviously is that I don't want this program terminated before we have an opportunity to reauthorize it. And that's why we're having this hearing and trying to move quickly. But in preparation, if reauthorization legislation is not signed into law by September of next year, the program is terminated. And in preparation for termination or possible termination, I understand that HHS has certain notice requirements you'd have to follow. Can you just tell us, what you'd have to do? I mean, obviously, this isn't what we want to happen, but I want to stress that, there's always that danger.
Well, it would be a nightmare for me personally, and it would be a nightmare for our members. It would be a nightmare for our CCE physicians. You cannot abandon a patient ever as a care provider. So we must ensure that that patient is taken care of somewhere. And finding a place for each of our 71,942 members would be a gargantuan task.
And there's notice requirements. When does that start?
We have to inform our patients ahead of time that this may happen, even though we may not be sure that it's happening, and certainly when it happens, and all of the efforts that we can make to help them support their efforts in finding additional.
But when does that process begin? Like, do you have a term notice?
Well,
requirement?
the 90-day time limit is sort of an unwritten notice requirement now. It can vary state by state because these are often state laws. But we have to go back and look at, since we have members from every state, we would have to look at every state's abandonment requirements.
All right. Thank you very much. Thank you, Mr. Chairman.
Chair thanks the gentleman. Now recognize the gentleman from Kentucky, Mr. Whitfield. 5 minutes for questions.
Well, thank you very much, and Dr. Howard, thank you for being with us this morning. I want to just follow up briefly. When we think about healthcare systems, frequently people all work with some company that provides health care or Medicare. You've got to be over a certain age, Medicaid, income below, TRIO, TRICARE. So here the common element is people from around the country, whether emergency responders or volunteers, came to respond to this emergency in New York, this disaster on 9/11. And you touched on the criteria. I think you've indicated there are 71,000 plus members enrolled in this program. And is it still eligible? If I'm someone that worked there during that time, would I still be able to enroll today if I'm not enrolled right now?
Yes, sir, you would be. And we hope that anyone listening who is not enrolled in our program who may be eligible will call our eligibility line and sign up for our program.
Okay. And I won't get into the details, but the criteria for eligibility, I'm assuming you had to have been there X days, and is that correct?
Right. There are very detailed eligibility requirements spelled out in the Act itself.
And does your office make the decision on whether or not a person is eligible or not?
Yes, sir.
Okay. Now, of the patients that you are caring for right now, what % of them would you say, or maybe you don't have this information, had an insurance program already? They were already covered under.
Well, first of all, even if you had health insurance,
right,
as a responder, you would not be able to use that insurance because health insurance does not cover work-related issues. For instance, if you've ever gone in for an MRI or a CT scan, at the bottom of that form, it will say, is this a result of an auto accident? Is this a result of a work accident? If it is, the health insurer will not pay for it. They'll refer you to other insurances. For survivors, then health insurance could be an issue. And then we recoup as much as we can from the health insurer.
Well, what % would have been covered under, say, workers' compensation program?
Well, theoretically, work-related injuries and illnesses would all be covered. But there are great difficulties for responders in accessing worker compensation benefits because oftentimes their condition, not the original conditions where on the event someone had an acute injury and it happened within a short period of time. But some of our diseases in our program, their onset are years later, and a lot of statutes draw a line and say, no, that's beyond our statute of limitations. We will not cover something that started 5 years later. So many of our members are in that situation.
So would it be unusual that workers' comp may pick up part of it and then this program would pick up sort of playing a supplemental role, or?
It's not unusual. Many of our members have had worker compensation benefits given, and we are in the process of recouping from workers' compensation. But it is not the majority, or even near the majority of our members.
We know some people have indicated early on, I remember when there was first discussion about this, that this was sort of a unique program, but I know that there's health programs in effect for employees at Savannah River, Paducah, Oak Ridge, and so forth, which is kind of similar to this because those workers were exposed to certain elements that many of them were not even aware of, and they came down with a lot of different cancers, and so those programs are similar to this program, would you say?
Yes, sir. And in fact, we administer the Energy Employees Occupational Illness Compensation Program together with the Department of Labor and the Department of Energy. It is a program that bears a lot of similarities to our program at the World Trade Center.
Yeah. And so if you worked at the World Trade Center and you're covered, and you have one of, say, 12 or 14 illnesses that you all have set out, is there a presumption that since you were there and exposed that you would be covered under this program?
Not a presumption. A physician, not in the administration of the program, but in our centers of excellence, would examine you, take your history, and make the connection between the exposure history that you give that physician and that health condition. And they alone say, I think the two are connected.
Right. Well, thank you very much for the great job you do at NIOSH.
Thank you.
Chair, thanks, gentlemen. Now recognize the gentleman from Oregon, Mr. Schrader, 5 minutes for questions.
My questions have been answered, Mr. Chairman. Thank you.
Then the chair recognizes General Ms. Castor, 5 minutes for questions.
I want to thank you, Mr. Chairman, for calling this hearing, and I'd like to thank all of the first responders and survivors and the medical professionals who take care of them for traveling here to Capitol Hill to encourage the Congress to provide some continuity and certainty in the World Trade Center health program. I'd like to thank my colleagues, especially from New Jersey and New York, Congressman Pallone and Congressman Lance. You all have been champions on this committee for this endeavor, along with Congresswoman Clark and Congresswoman Maloney. I see Congressman King, I think, was still here, and the entire New York delegation especially. I strongly support the James Zadroga 9/11 Health and Compensation Reauthorization Act because it will provide that important certainty and continuity of care from this point forward. And it's interesting to see the list and understand that there are first responders and survivors from the World Trade Center terrorist attacks all across America now. And Florida comes in right behind New York and New Jersey. So it will be very important, and I think that the folks that I represent back home will be strongly in support of taking care of their neighbors who were there on September 11th and the weeks, months, and years afterwards. It is vital that we continue this specialized care for all of our neighbors and all of the brave folks who were there on September 11th. So, Dr. Howard, thank you for being here today. One of the important parts of the World Trade Center's Zadroga Health Initiative that often gets overlooked is the funding provided for research into 9/11 related health conditions. Between fiscal year 2011 and 2014, the program funded 35 projects to investigate questions about 9/11 related to physical and mental health conditions. Could you provide examples of the research that has been funded by the Zadroga Act?
Be happy to. We're very grateful for the original drafters of the legislation to provide money for research into the health conditions that our members face. And as I mentioned before, we've already learned quite a bit from that research. And I'd like to highlight just one aspect of it. In addition to mental health and respiratory and cardiovascular and our cancer research in autoimmune diseases and others, is the research that we've done on individuals who were children at the time of 2001 attacks. There were a number of elementary schools and Stuyvesant High School, for instance, that were immediately impacted. And we have a number of those projects that are going on now, about 7 that are funded, and we're learning the effects on developmental issues in the children's population. To date, we've funded $88.5 million worth of research, and we have a significant body of research that is published in peer-reviewed journals. The World Trade Center Registry alone has published about 60 papers, and our various clinical researchers at our clinical centers have published the other papers. Our pivotal papers in cancer, autoimmune diseases, asthma, and other respiratory disorders have allowed us to provide better care, more focused care for our members.
And are these, the results of the research, are they disseminated in an organized way to the providers and the families so that they have access to all of that information? Yes,
we have membership newsletters that highlights various findings that we have from research so that they know. All of our papers are published on the World Trade Center Health Program's website. And, of course, these are all peer-reviewed publications, so they appear in the science journals. And I'm happy to say that the New York media picks up on those papers and reports them probably more effectively and more widely than we can on our website.
So if the Zadroga Act is not reauthorized, will these research efforts come to an end, and explain to me why that would be harmful?
They would cease altogether, and we would lose one of, I think, the most important advantages of the program to our society is looking at the long-term health effects from 9/11.
Okay. And you testified earlier that health conditions often manifest themselves years later. The Zadroga Act provided funding for outreach efforts to individuals who may be eligible We're now several years into the existence of the program, and you have successfully enrolled more than 71,000 responders and survivors. It seems to me that in addition to outreach, the continuity of care and retention of members will be important to protecting the health moving forward. That's why the Reauthorization Act here clarifies that funding may be used for continuity of care and retention. Give me your opinion on why efforts on continuity of care and retention of members will be important moving forward.
Well, as you say, our program overall since its inception in July of 2011 with the Zadroga Act has grown about 18% overall in membership. And we credit that to the wonderful contractors that we have who have done recruitment. But the other side of that is once you recruit a patient into our program, we want them to remain in our program. And every health plan loses members because we do not go and do outreach to retain them. So that's on balance now after our first 5 years. We hope to emphasize in what we hope is our second phase that retention of our patient population is as important as their original recruitment.
And how do you propose to do that for first responders and survivors outside of the New York, New Jersey area, say in the state of Florida?
I think, first of all, we do things as a team. We sit down with our representatives from survivors and responders. We have a responder steering committee, which is very active, meets every month, and we have a survivor steering committee that's very active and meets every month. All of our ideas, suggestions, we go to them and say, how are we going to do this? And together as a group, we figure out how to do it. There are many modalities that we could use, and oftentimes we're told by our members what is the most effective.
Thank you very much, sir. I yield back.
Chair, thanks. The gentlelady now recognizes the gentleman from Texas, Dr. Burgess, 5 minutes for questions.
Thank you, Mr. Chairman. Thank you for having the hearing, Dr. Howard. Thank you very much for being here today. And to all our witnesses on the second panel, thank you for your participation and the people who are here in testament to the work that you've done. I also feel obligated to recognize the work of one of our colleagues, a former member, Vito Fasella, who was on this committee with us and in fact was responsible for my early interest in this shortly after I arrived in Congress in 2003. And it was because of that interest that I did become an early supporter of Representative King's work on this. And in fact, I was the one who ran the bill on the floor in the waning days of the 111th Congress in that late lame duck session in December when the bill finally did pass on the floor of the House. But Dr. Howard, I'm interested in, you said in your testimony that you provided for us today that certain types of cancer were added to the list of health conditions covered under this act. Could you share with us what those cancers, what types of cancers those are?
Yes. Currently covered in the program are every type of cancer. It's the short way to approach this. Every type of cancer except uterine cancer.
Are there those that are more? I mean, what if you were to pick the top three malignancies? What would those be?
I think if you looked at our 4,000 or so cases right now, probably the top ones would be thyroid cancer. There are 5 common cancers that Americans get, skin being the one. That's our top cancer. There's breast cancer. That's also a top cancer for us. There's colon cancer, which is a top cancer for us. Thyroid cancer is another cancer for us. But we've seen a lot of very common cancers like that, and we've also seen some very rare type cancers. And oftentimes, from an epidemiological basis, the appearance of rare cancers is extremely helpful in terms of doing research on a population to figure out what their exposures are causing rare cancers.
Sure, and that speaks then also to the value in having people who have expertise in treating the types of injuries encountered, because an uncommon cancer can be a difficult diagnosis to which to arrive.
Exactly. And if this cohort were distributed, we would not be able to count those. It would be very hard to find all those rare cancers if the patients were not seen in our clinical centers, and rather they were seeing their own personal physicians throughout the United States. It was very difficult to do that.
So it provides a focus that otherwise would not be available. It's just as far as just a brief comment, if you will, on the observed versus the expected cancer rates in the population that you're following. Is this number of, I guess I calculate it to be 6% based on the number of patients you're following and the cancers you reported. How does that stack up to the general population?
Well, that comparison, I'm afraid, we can't do at this time. That would be something that we would have to wait and see what our researchers could come up with in giving us that kind of number. We're now looking at, and the Fire Department of New York City is doing some research using as a referent population to compare our World Trade Center firefighters to another cohort that was assembled by the Institute of Firefighters not involved in World Trade Center. So we hoped that line of research could answer your question someday.
So it would give a better control if you age match for people who are in similar occupations.
Yes, sir.
Just switching gears a little bit, and you mentioned also in your testimony that you're trying to aid not just the individual members but help grow the body of evidence and the body of information so that you can help in other situations. Are you going to be able to provide feedback to municipalities and boroughs as to the type of workers' compensation coverage that may be provided to members of the firefighting community, or the type of health insurance that's provided? Some of the shortcomings you mentioned were within the workers' compensation system. Are there lessons you've learned that can be extrapolated to other communities?
Well, certainly, and I think New York State itself, its legislature and governor have already responded to this issue significantly by providing a mechanism by which responders, survivors, can sign up to a program. They don't have to actually make a claim, but they can register, and then if they should develop a condition later on, that their claim would not be beyond the statute of limitations. So other states have also looked at that, and we hope that people will learn, especially from these long duration disasters.
Thank you, Mr. Chairman. I'll yield back.
Chair, thanks, gentlemen. Now recognize the gentlelady from Illinois, Ms. Schakowsky, 5 minutes for question.
Thank you, Mr. Chairman. I, too, would like to thank all of the first responders, the survivors, those who treat them, for coming here today. For the first responders and the survivors, I'm sure in addition to some health conditions that may be more visible, that the trauma of the incident and the loss of friends, coworkers, family is something that lingers on forever, really. In Illinois, Dr. Howard, there are 13 first responders and between 1 and 9 survivors. The way the data is kept, it's between 1 and 9, enrolled in the World Trade Center Health Program. So clearly there's no concentration of those individuals in any kind of program of nationwide providers. So I imagine there's physicians that have 1 or 2, et cetera. So how do you maintain the cohesiveness of that network?
I think that's a very good question, and I think there's a couple ways that we do that. First of all, our nationwide provider network is headed by a very capable physician who is a part of our New York-based centers, New York and New Jersey-based centers of clinical excellence. So he participates in all of our meetings and is a great educator and teacher for the cadre of physicians that do monitoring and evaluation of that population. As you point out, a physician may have only 1 or 2. Those physicians themselves are occupationally trained. So they have the same kind of training to be able to connect exposure and health conditions as similarly situated physicians at our clinical centers. As I mentioned, we're also trying to, we've been very pleased that Medscape is helping us put together constant training, so to speak. 24/7, you can go to their website and get information about the latest findings from the program that may influence your practice. So even though we have a distributed network, and even though those physicians in the nationwide provider program may have, as you say, 1 or 2 patients they're seeing, we want them to be as similarly situated knowledge-wise as the rest of our physicians.
Great, thank you. So my understanding on the data is that there are a total of 71,000 people, or approximately, that are in the program. And then it says in a fact sheet I have that more than 30,000 responders and survivors have at least one World Trade Center related health condition. So there are some people in the program, I gather, that are more than half that are simply, not simply, but that are being monitored. Is that the difference in number?
Yes. We offer monitoring and treatment. So if you're in the monitoring program and you do not have a health condition that is included for coverage in our program, then you come on a periodic basis for monitoring. So you're not in treatment. There's no condition that a World Trade Center Health Program physician has connected to your exposure. So they are continuously
but the monitoring is done within the network, and there's not an additional cost to that individual for the monitoring.
No,
okay.
Our members bear no cost.
So the population that you serve includes some number of families of the or spouses of firefighters. Some are in that program. Survivors that may be workers in the area, residents, students, daycare participants, etc. I'm wondering what the breakdown is between first responders and then survivors.
In terms of enrolled members in our program. So currently, total enrollment of the population, as you say, is 71,942. General responders, which would be police, construction workers, volunteers that came from all over the United States, is about 38,953. Our fire department members are 16,569, which leaves 8,133 survivors in that 71,000.
Does anybody leave the program? Aside from this issue of re-enrollment. So do they have to re-enroll every year?
I'm sorry?
Do they have to re-enroll?
No. You're enrolled once in our program.
Does anybody leave?
I hope not, but I do not know that for a fact. We have members who have passed away,
well, certainly.
but leaving, they may go to their, as has been said by Representative Pallone, they may go to their private physician to obtain health care for other non-related conditions.
Thank you very much.
Chair, thanks, gentlelady. Now recognize the gentleman from New Jersey, Mr. Lance. 5 minutes for questions.
Thank you, Mr. Chairman. I don't have any questions, but I want to thank you for what you're doing, Dr. Howard. I want to thank Congressman Pallone, who has worked on this issue over the course of the last more than a decade, and all of the members of the Congress who recognize the importance of reauthorization of this legislation. This is a bittersweet hearing for me. New Jersey lost more than 700 residents. My son was playing freshman high school football, and he had a teammate whose father didn't come home. I lost a Princeton classmate in the South Tower, and my story is similar to the stories of many. I think the best speech that the younger President Bush ever delivered was on September 14th at the National Cathedral, where he said that this world God created is of moral design, Grief and tragedy and hatred are only for a time. Goodness, remembrance, and love have no end. And he concluded by paraphrasing St. Paul to the Romans that no evil can separate us from God's love. What you have done is based on goodness, remembrance, and love, and that's certainly true of the first responders. And I thank all of the first responders, and I'm sure this legislation will pass unanimously here in the full committee and on the floor of the House. Mr. Chairman, I yield back the balance of my time.
Chair, thanks, gentlemen. Now I recognize the gentleman from New York, Mr. Engel, 5 minutes for questions.
Thank you very much, Mr. Chairman. And, you know, I too, there's none of us that represent New York or New Jersey, the surrounding area, that wasn't deeply affected. There are 1,851 people in my district who are program beneficiaries of all you do, Dr. Howard. So we're very, very appreciative of it. You've answered some of my questions, but I want to try to bring out certain other things. Many of us in the aftermath, Mr. Lance just mentioned that the Friday after the Tuesday of the attacks, many of us in the delegation went to the site of the attacks. It was surreal. You just scratched your head and you couldn't believe you were really, it was like a nightmare. You couldn't believe you were really living it, and then you kind of realized every few seconds this is real. And so we walked around, other people walked around. We really weren't wearing the masks. They did give us masks, but didn't really make it seem as if it was that important. So I bet a lot more people got exposure. I mean, I went back several times. I don't have any ill effects, thank God, but people who are now starting to get effects, do we have trouble tracing it back? Is it difficult for people to prove so many years later that their illnesses are a result of exposure they got at the World Trade Center site?
It is difficult. It's difficult for any of us to recall exact details of what we did a month ago, a year ago, let alone this many years ago. So for new members coming in our program, a lot of the questions that we ask about their exposure they're very difficult to answer. Recall is imperfect in all of us, but we take that into consideration in terms of the questions we ask them, the answers they give us.
First of all, Doctor, thank you for the great work you do, really great work. It makes me proud to have been an original co-sponsor of this legislation, and I think in all the years I've been in Congress, I've never seen our delegations more united on one thing, particularly the New York delegation. Since the program has been continuing, and obviously when things continue, you see what works, what doesn't work, you make adjustments. What would you change in the program? What have been some of the things that you have found difficulty with that perhaps we should consider modifying or changing to make it more efficient?
Well, I don't think that that we found anything in the Act that has been a showstopper for us in administering the program. We look at all of the items in the Act as helping us, and we consider the Act to be a well-written document that's given us a roadmap. And as for so many years, for over a decade, we had no authorizing language. So we made it up as we went along together with our clinical centers of excellence. So we're extremely happy to have this authorizing outline for us.
How much flexibility exists with regard to the World Trade Center Health Program's eligibility requirements? For example, if someone meets 9 out of 10 benchmarks but is desperately in need of care, can exceptions be made to ensure that care gets to those who need it? How does that work?
We look at every case on a case-by-case basis. As I said, recall is not perfect this many years later, and we take that into consideration. We only decide that somebody is not eligible when we're absolutely certain that they do not fit any of the stated criteria in the Act. If we err at all, it's on the side of including someone in the program.
In your written testimony, you noted the work that's been done through the World Trade Center Health Program. work has been done to understand the impact that 9/11 had on children, and I understand that the program has funded research projects to specifically examine the effects of 9/11 on the physical and mental health of children and adolescents. Can you talk a little bit about that?
Well, first of all, we're very privileged to have a number of researchers in New York who are interested in this area of pediatric research for 9/11. And as I say, we have 7 projects that are funded in this area. They have not been completed as yet, so we're looking forward to those findings. So I can't report today about what those studies are showing. But it's important that that we have them and that they continue, and we're very privileged to have a couple of very good researchers working on that.
Thank you, Doctor, and again, thank you for all you do, and we're really very, very grateful to you. It affects those of us in the New York area every single day, and our constituents are grateful. Thank you.
Chair, thanks, gentlemen. I understand Dr. Bouchon doesn't have any questions. Chair recognizes Ms. Brooks from Indiana, 5 minutes for questions.
Thank you, Mr. Chairman. Dr. Howard, I'm a former deputy mayor of Indianapolis in the late 90s, and we hosted the World Police and Fire Games in the summer of 2001 before the 9/11 attack. And there were many New York, New Jersey firefighters and police officers who perished in the attack. New York firefighters who perished that had participated in those games. But we also had a group called Task Force 1 that traveled from Indiana to the World Trade Center. And I've since learned, because of this hearing, that we have 53 people in the state who responded. I have 12 in my particular district, and I want to pay particular tribute, as other colleagues have done, not only to all of those from New York and New Jersey, but people like individuals from Task Force 1, who's engineers and technical experts, and their search dogs traveled immediately that day and continued to operate around the clock with all of their brothers and sisters in New York. There was a story several years ago about an Indianapolis fireman and a member of Task Force 1, Charlie Gleasing, who was deployed, and he said in that TV story, he said, and I quote, he got a little bit of that World Trade Center cough from that mix of the fumes, but he said that he would gladly answer the call again. And that you understand the risk, but we have to take care of the men and women that are going and that continue day in and day out to risk their lives for fellow citizens. And I want to thank you and all of the men and women who are here today for their service, and all the men and women around the country who did answer that call. I'd like to ask you what you lose sleep about with respect to this program. What are your greatest challenges? You've answered incredibly well so many questions posed to you, but what would you say are the greatest challenges facing this program that we must reauthorize? And how do you plan to respond to those programs, or to those challenges?
The biggest thing that worries me is that I would have to spend any amount of time, waste my time closing the program, as opposed to growing the program. And the manner in which you plan to grow the program, how do you plan to do that? I think, one of the issues that we've faced in the program, and I think I can speak for all of our clinical centers of excellence directors and our nationwide provider network, is when the bill passed, the President signed it on January 3rd, 2011, we had to be up and running July 2011. It was a very short implementation time. By a lot of work, by a lot of people, we were able to open our doors on July 1st, 2011. But I think what we've done over the last 5 years, and we hope to continue to do, is quality improvement of the services we offer. Our pharmacy benefit plan, for instance, and other support for our members. We want to receive their input so that we can continue to improve the program.
Thank you. Thank you for your service. I yield back.
Chair thanks, gentlelady. Now I recognize the gentleman from New York, Mr. Collins. 5 minutes for questions.
Thank you, Mr. Chairman. And I, too, want to recognize all our first responders here. I think anytime you come as you have, it just helps members of Congress in what we know is going to be a bipartisan support, and as previously stated, to unanimously pass this reauthorization. But first of all, Mr. Chairman, I'd like unanimous consent to enter into the record a statement from Representative Dan Donovan, who represents Staten Island and a portion of Brooklyn.
Without objection, so ordered.
And I'd also like to recognize Representative Peter King that's with me today, and thank Dr. Howard for all you've done. You've pretty much answered, I think, most of our questions. I represent 105 towns of western New York in the Buffalo into the Finger Lakes area, and I believe probably most, if not all, of our volunteer fire departments, and we're mostly volunteer, we have one paid fire department in my district, sent individuals down to ground zero. That's what firefighters do and first responders. It's a community, a brotherhood, and I'm just happy to have learned more today about how those individuals are more than likely in your program being monitored. And I think, again, on a bipartisan way, we're with you, and you're doing great work. And I don't believe you're going to have to lose any sleep about shutting this program down. With that, Mr. Chairman, I'd like to yield the remainder of my time to Representative King if he would have any comments that he would like to add.
That's appropriate.
Chair recognizes the gentleman.
Thank you, Mr. Chairman. And I do appreciate the opportunity for you allowing me to sit in and take part in the hearing. I thank the gentleman from upstate New York, Mr. Collins, for yielding time. I would just like to say that there is probably no more important bill we passed during the time that I've been in Congress than this 9/11 Zadroga Act. I had about 150 fatalities from my district, but more than that, I see every day, to this day, people still have rare lung diseases, respiratory illnesses, blood cancers. So this is something that's absolutely necessary to continue. And I know that people may find this might be wrong or that might be wrong. The fact is, this is as effective as any program I've seen since all the time I've been in Congress. And it provides a need which is a lasting need. It's absolutely essential to go forward. And I want to thank all the men and women here today, the first responders, FDNY, NYPD, construction contractors. I saw Mr. Nadler come by before. Certainly, people who are residents of the area, and really everyone who answered the call that day, everyone who did what they had to do, and those who are suffering these illnesses, people in the prime of life who have, again, lost their jobs, have these debilitating illnesses which have changed their lives so radically, all because they do what had to be done. So again, I thank the chairman for holding this hearing. I thank the committee for taking this issue up. I thank all of you for being here today, and I certainly thank Mr. Collins for yielding me his time, and I yield back to him. Thank you, Mr. Collins.
Chair, thanks, gentlemen, and now I recognize the gentlelady from North Carolina, Ms. Elmers. 5 minutes for question.
Thank you, Mr. Chairman, and thank you, Dr. Howard, for being with us. And I, too, want to thank all of the first responders who are here today. A very emotional subcommittee hearing, and so I'm going to try hard to stick to the information and get into some of these questions. Along the lines of where we are today, and I know that you have already stated, Dr. Howard, that as the number of affected first responders have come forward, those who have been determined to have cancer, how many are in existence right now? How many are with us? What number do you have of potentially affected patients who have a diagnosis of cancer?
Well, right now we have about 3,400 cases of cancer, individual cases of cancer. Some of those cases may represent an individual that may have more than one cancer, but generally speaking, that's the number of members that we have who we have certified with cancer.
Now, as far as the certification process, I'm just curious as to how you determine approval or denial, and do you have numbers that play out as far as the possibility of being approved or denied?
Sure, and let me just briefly explain the process. The physician who is seeing the patient makes the connection between their exposure and the health condition, in this case cancer. So they can say that it's caused by, contributed to, or aggravated by their exposure. That's the determination that's made by the physician. We don't make it in the program. That's an independent view that the physician has. Then they submit it to us, and we make sure that all of the supporting information is there, and then we certify it. If the supporting information isn't there, we have a question, we go back and forth until we're all absolutely sure, including the determining physician and us, that this is a case to be certified. Certification then means that you get your cancer covered for health care.
And having the concentration on cancer leads me to the next question, which is, do you anticipate adding other possible diseases outside of the cancer realm?
Well, we've received to date 7 petitions for requests adding conditions. 2 of those were cancer. The original cancer petition that Chairman Pitts referred to, 001, and then soon after that we had a petition with regard to prostate cancer, and then 5 others. With the 5 others, we did not find sufficient scientific evidence to support their addition. We get quite a few requests for adding conditions. It's hard to estimate what conditions we would add in the future, but we evaluate each of those requests on their scientific basis.
And then in regard to autoimmune diseases, I understand that you have made a determination that those would not be identified or added.
Right.
And can you just expand on that?
Right. We received a petition, our last petition, to add a large number of autoimmune diseases to our statutory list. We reviewed all the information, including the very excellent study that had recently stimulated that petition by FDNY, and we found that it was insufficient at this time. It doesn't mean that, and that this is why I emphasize so much the importance of research funding in this program, is the additional work that is going on by other CCEs and our World Trade Center Health Registry to look into that issue. So it doesn't mean that forever and ever it will not be added, but at this time we're not adding it.
Well, thank you, Dr. Howard. I do appreciate all of the information that you've helped us with, and I am glad to know that this is considered to be an ongoing process into the future, because we don't know what the future holds for this. And again, God bless all of the first responders who are here and your families. Thank you so much. I yield back.
Chair, thanks, gentlelady. Now that all the members of the subcommittee have had an opportunity to ask questions, with unanimous consent, I ask that member of the full committee, Ms. Clark, be given 5 minutes for questioning. The chair recognizes Ms. Clark.
Thank you very much, Mr. Chairman. We have been joined here by Congressman Gerald Nadler of New York, original sponsor of the Zadroga Act, and I wanted to yield us some time to him at this.
I thank you for yielding, and let me thank the chairman for holding the hearing and the members. I simply want to say that as someone who was along with Mr. King and Ms. Maloney, was one of the 3 original sponsors of this bill. We struggled for years and years to pass it. I'm glad to, and the history has proven the necessity of this bill. I want to thank Dr. Howard for his wonderful service. I'm glad that the chairman has called this hearing, and that, judging from the comments at the hearing, there seems to be a lot of bipartisan support for extending this bill. We know the necessity of that. So I just want to urge that that be done, and that and I thank the chairman and the committee again. Extension of this bill is essential because the diseases won't go away, and this is for both the first responders and the survivors in the community. So I urge the extension of the bill. I thank Ms. Clark for yielding, and I yield back to her.
Thank you. Dr. Howard, just following up on a couple of the questions that Ms. Elmers asked about the conditions. For the record, what is the process by which you can add new conditions to the program?
Well, first of all, the administrator has the ability to add a condition on his or her own motion. The other very common route that we've seen so far is the public can petition the administrator to add a condition. As I say, we've received 7 petitions so far. 2 of those we have added the condition, the first one being cancer, the second one being a particular type of cancer, prostate cancer. The other 5 we have found insufficient evidence for.
I understand that the statute outlines specific timing requirements for you to respond to those petitions. Could you describe that for us?
Right. The administrator has 60 days to respond to a petition unless the administrator refers the petition to our Scientific and Technical Advisory Committee, and then the time frame is 180 days. So for instance, in terms of the first petition on cancer, we referred that to our Science and Technical Advisory Committee. They had 180 days to make their decision.
Do you have any concerns with the statutory timeframes under which you would have to respond to such petitions?
Well, one of the things that the GAO report pointed out in their review of our cancer petition and our addition of cancer was that there was no external peer review of our science that we use to justify the addition of cancer. We believe in peer review very, very much, and we want to do external peer review. But the time frame of 60 days was just, given the enormity of the task of adding all those numbers of cancers, that was a very short period of time, so we were unable to engage in external peer review.
Very well. Can you briefly tell us about the registry? It's our understanding that it was created to follow individuals who were exposed to environmental toxins related to the World Trade Center terrorist attack. Tell us a bit more about the registry and why it is an important tool for studying the WTC-related health effects.
The World Trade Center Health Registry, which is operated by the New York City Department of Public Health and Mental Hygiene, is a vital participant in the research aspects of the program. They started very soon after 9/11. They have, interestingly enough, about 71,000 members also, and I might add, I was told by the director last week that they have registrants in the registry from every congressional district, all 435. And they have produced almost 60 papers in this area. They follow the same people over periods of time. So they every so many years they study them to figure out what their experience is. So their research is vital to this program.
Do we have a sense of any of their findings so far?
Oh, all of their findings are not only on their website, but also on ours. And I think some of the things that we've learned already, the issues about asthma, mental health, persistent PTSD, et cetera, have come largely from the World Trade Center Health Registry studies.
So you think it's important that we continue our work?
Oh, it's absolutely vital.
I thank you very much, Dr. Howard. And I yield back. Thank you, Mr. Chairman. I thank the ranking member.
Chair, thanks to the gentlelady. That concludes the questions of members here present. I'm sure, Doctor, we will have follow-up questions from members. We'll send those to you in writing. We ask that you please respond
Thank you,
promptly.
Mr. Chairman.
Thank you. That concludes our first panel. We'll take a 3-minute recess as the staff sets up the witness table for the next panel. Committee stands in recess.
I know that, yeah. That's why.
Time of recess having expired, we will reconvene. I'll ask the guests to please take their seats. Ladies and gentlemen, please take your seats. The committee will reconvene. I'll ask the guests to please take their seats, and I'll introduce the second panel. We have 3 witnesses on the second panel, and I'll introduce them in the order which they will present testimony. First, we have Dr. Iris Udison, Medical Director, Environmental and Occupational Health Sciences Institute Robert Wood Johnson Medical School. Welcome, Dr. Udison. Secondly, we have Mr. David Howley, retired police officer, New York City Police Department. And finally, we have Miss Barbara Burnett, former detective, New York City Police Department. Thank you very much for your patience, for coming, for your testimony. Your written testimony will be made a part of the record. You will each be given 5 minutes to summarize. There are a series of lights on the table, so you'll see green first, then yellow. When red appears, we ask that you please conclude your testimony. So at this time, Dr. Udison, you're recognized for 5 minutes. Summarize your testimony.
My name is Iris Udison, and as I serve as director of Rutgers Clinical Center of Excellence in New Jersey. We are one of 6 clinics in the New York, New Jersey area that provide medical monitoring and treatment for World Trade Center first responders. I am a physician who is board certified in internal and occupational medicine, and I am a professor at Rutgers and a member of the National Toxicology Panel, an expert panel that advises the National Institute of Environmental Health Sciences concerning the relationship between exposure to toxic chemicals and health. I want to thank the committee for giving me the opportunity today to testify concerning the importance of our clinical centers of excellence and for the opportunity to provide the best quality medical care through the Zadroga Act to those brave responders who have suffered from multiple chronic and often disabling medical illnesses, including pulmonary fibrosis, sarcoidosis, asthma, gastric reflux, sinusitis, and sleep apnea. We have been monitoring World Trade Center patients in New Jersey since January 2003 and began treating patients with federal funding starting in 2007. In addition to the treatment of the aforementioned conditions, over the past 3 years we have been able to use our funding under the Zadroga Act to optimize cancer care. This is critical since as early as 2008, our responders were already showing a cancer rate that was 15% higher than people their age who were not at the disaster site. This rate is only increasing, and our patients are much younger than usual cancer patients and are non-smokers. They were highly exposed to environmental toxins as well as severe mental health trauma from what they witnessed as ground zero, from seeing people jumping off tall buildings to their death, or finding charred remains. Our designation as a clinical center of excellence has allowed us to provide quality of care for these responders by centering all their care in a convenient location with staff members sensitive to their needs, coordinating treatment from start to finish. The combination of program-wide knowledge gained over 12 years of care delivery, in addition to my personal knowledge in New Jersey, has allowed us to understand this cohort of patients using medical and pharmaceutical resources wisely to accomplish the following objectives, which I will illustrate with specific patient examples. Coordination of care for complex cases, diagnosis and treatment of patients considering both physical and mental health aspects of disease, use of state-of-the-art diagnostic techniques for early diagnosis and treatment, use of knowledge gained in our treatment of patients to allow for early intervention, enabling our skilled patients to stay at work. I am proud to share this panel with David Howley, a retired police officer who performed many months of search and rescue work at the site. David presented with swelling in his neck in 2006, which was eventually diagnosed as an aggressive metastatic cancer of the throat. This is an unusual and rare cancer in healthy, non-smoking Americans. However, in my center, we have seen 8 other patients with this cancer in New Jersey alone. David's treatment has required a team of doctors, including myself as primary care, the general oncologist, the radiation oncologist, the general surgeons, the ear, nose, and throat surgeons. Because of the complicated nature and location of his cancer, it has been extremely difficult to treat, but at the present time, he's tumor-free since April of 2014. The second patient I want to tell you about is a retired detective with severe shortness of breath, chest discomfort, fatigue, and inability to perform his duties as a police officer. He was present at the 9/11 site on the date of disaster, reported being engulfed in the dust cloud and witnessing people jumping out of buildings. He was treated by his personal physician with 5 medications for his respiratory issues, but no other conditions. His evaluation at our center confirmed the presence of asthma, but we were also able to diagnose rhinitis, gastric reflux, sleep apnea, post-traumatic stress disorder, and panic attacks. This patient was given treatment for those conditions and received therapy for PTSD and panic disorder. The patient was able to recognize that his panic attacks were causing him to use increased amounts of his asthma medication, and he learned to control his attacks. At his most recent examination, he no longer needs mental health medications and is enjoying his retirement. The third patient I want to speak about works as a consultant to prevent tax fraud. An abnormality was noted on his CAT scan, his chest X-ray, and he was referred for a CAT scan. A small nodule was noted in November of 2014, which grew larger in January. This was evaluated by a radiologist who is an expert in interpreting lung CAT scans. She was concerned about the suspicious nature of this nodule and its growth since the original scan. This patient was referred to our university surgeon, who removed a stage 1 lung cancer, which does not need chemotherapy or radiation. And I want to say this patient is back at work. He's overseas looking for people who have cheated the government paying taxes. And finally, Rutgers University and NYU have combined to do research finding markers for sleep apnea associated with environmental exposure. This expertise has allowed for early diagnosis and treatment of obstructive sleep apnea, enabling us to get people to work safely. My fourth patient is a pilot for a law enforcement agency with a history of GERD and sinusitis, which are risk factors for sleep apnea. Thanks to early diagnosis, this patient has been successfully treated for his conditions, and he is fully qualified under federal standards to skillfully operate his aircraft. He asked how he could thank me for his treatment, and I said that he should continue catching terrorists. In summary, all of our patients are honored and treated by skilled clinicians. We believe we are continuing to acquire the knowledge to provide early diagnosis and treatment of emergency responders who are exposed to toxic agents and psychosocial stressors. We are striving to continue to achieve excellence and cost effectiveness in treating our patients, as well as preparation for providing the best possible medical care for any emergency responders who are exposed to a multitude of unpredictable exposures. Thanks
Chair,
for the extra time.
thanks to the gentlelady, and now recognizes Mr. Howley, 5 minutes for your summary.
Thank you, sir. First thing I'd like to do is thank you for having this hearing. It's obviously very important by the amount of people that are here today, and it's both an honor and a privilege to be here and address you. There's a lot of things I'd like to say about this, but I think the most important is to answer a question that you all basically posed to Dr. Howard, and that is, what happens if? And Dr. Howard was wonderful in his answers, but I think I'm going to be a little more blunt about it. People are going to die. The men and women that are sick, that are being taken care of now, I've only been cancer-free a little over a year. I could easily, and if it wasn't for this lady right here, I wouldn't be here at all. So to end this program, people are going to die. It's a fact, it's unquestionable, and that's what's going to happen. I was born and raised in Mr. Pallone's district, and lived in his district once I retired, and now I moved a few years ago, and I live in Congressman Lance's district. So I have both sides of the aisle covered here. This is not something that should have any political fighting. This should be an absolute bipartisan 435-0 type bill. This is a ground ball, a no-brainer as far as I'm concerned. And as the other and the last point I'd like to make, because I'm going to try to keep this brief, is I wouldn't be here, sitting here, if it wasn't for the doctors and Dr. Udison's and her other colleagues' knowledge, skills, abilities, research. They have become the absolute experts in what is ailing us, and not just me, but all the other people that are part of this program. You can't go to your regular doctor. They don't have the knowledge. They just don't. They're not bad doctors. There's nothing wrong with it. But what has happened to us because of the conditions that we were in has become very specific. And I didn't have a normal cancer, and there's a lot of other people that don't have normal cancer or normal blood diseases. And because of their absolute dedication, they have come up with plans and outlines and that they can treat and get us through these difficult diseases. And that is the most important thing, is that we can have a quality of life to go forward. And I'm going to leave it at that. I'll be happy to answer any of your questions.
Chair, thanks, gentlemen. And now recognize Ms. Burnett. 5 minutes for your opening statement.
Oh, thank you. Subcommittee, Ranking Member Green, and members of the Subcommittee on Health for inviting me to appear before you today. My name is Barbara Burnett, and I live in Bayside, New York. I am 52 years old, a wife, a mother, and a grandmother. With me here today are my husband, Libro Sr., and my son, Libro Jr. I am a proud former New York City police detective. I retired from the department after 18.5 years of service. My career came to an end because of an illness I developed from the time I served at the World Trade Center site. I served there for more than 3 weeks, about 23 days in total. The morning of September 11, 2001, I was working in Brooklyn, New York, in the Gang Intelligence Division. When my fellow officers and I learned that the morning of the terrorist attacks in New York City, we rushed to Lower Manhattan, the fastest way possible, which was by boat. When we arrived, the towers had collapsed. The air was thick with dust and smoke. I put my hands over my mouth and nose just to breathe. My fellow officers and I worked all day and well into the night. We evacuated people from around the World Trade Center site. We directed them away from the disaster. There was so much dust, but I was not given any respirator or any kind of protection for my eyes, throat, or lungs. I had to wash out the debris of my eyes and throat, picking up a hose. My fellow officers and I, along with all the rescue workers and first responders, could not stop doing what we had to do. The first night, I finally left the World Trade Center around 10 p.m. after 12 hours. 5 hours later, I reported back to the World Trade Center site at 4 a.m. in the morning on September 12th. I removed debris by using buckets and shovels, and at no time was I provided with respiratory protection. If I was not crying over what I was seeing in the room, tears streamed down my face from burning, irritating dust. I spent weeks at the World Trade Center site, shoveling, clearing away debris, searching for survivors, and later sifting for body parts of the dead. We worked side by side and hand in hand with iron workers, construction workers, firefighters, police officers. All of us searched in the dust and removed debris together. We were searching and removing wreckage of the World Trade Center. We were working night right on top of the burning, smoky, hot rubble. The fires never stopped burning. Air quality, we were told, was not a concern. All of us working 24/7. The work was tough and dirty. We were choking, and it was dangerous. But there was never a time when I even thought about quitting or leaving. I thought of thousands of poor victims. If our work brought the removal and recovery efforts closer to the end, we were glad to contribute. I live with the consequences of 9/11 every day. I have been diagnosed with interstitial lung disease, more specifically hypersensitivity pneumonitis with fibrosis in my lungs. The inflammation in my lungs interferes with my breathing and destroys the tissues that get oxygen to my blood. My lungs are permanently scarred. I cannot move around my home or take the stairs without wheezing or gasping for breath. I start each morning connecting to a nebulizer and inhaling multiple doses of medications. I am told I will eventually need a double lung transplant. Long steroid use has caused weight gain, and other prescription medications have caused many additional illnesses. I have been diagnosed with diabetes, high blood pressure, osteoarthritis, and rheumatoid arthritis. I have suffered partially detached retinas in both eyes, each requiring surgery. Prior to my World Trade Center service, I was in top shape. I had no history of lung disease. I never smoked. I always had a physically demanding lifestyle and career. During my time with NYPD, I worked for 5 years in the plainclothes narcotics unit. These assignments required me to walk 4 miles per day, making arrests in buy and bus operation and executing search warrants. I have made over 200 arrests in my career and have assisted in hundreds more. I have been recognized by the NYPD numerous times for excellence police duty. I have also received several medals for meritorious police duty. I was born and raised in Brooklyn, New York. I played high school and college basketball. I played on the Police League women's team, which competed across the United States internationally. Life has become very different since I became sick. Every month, I see the doctors at Mount Sinai to receive care and renew my prescriptions. This program saves lives. It is saving my life today. It provides medical structure in my life by coordinating doctors and medications. My family does not have to suffer the financial burden of doctor's visits, co-payments, deductibles, and the terrible cost of prescription medication, which I would not be available to me without the program. I would also note that the health conditions are worsening. Many of the first responders' colleagues have been diagnosed with cancer. Many colleagues have died of cancer. The amount of dust to which we were exposed was unprecedented. Many of us fear cancer and other injuries that arise late after toxic exposure. Recently, more than 60 types of cancers have been identified by medical researchers as being directly related to the toxins found at Ground Zero. Cancer arises years and years later. For these reasons, I would urge the committee to approve the bipartisan legislation before it. Thank you.
Chair thanks the gentlelady and thanks all the witnesses for their testimony. I will begin the questioning by members and recognize myself 5 minutes for that purpose. Dr. Udison, we'll begin with you. In your testimony, you talk about the coordination of care that your clinic provides and that you can spend time with your patients. Can you elaborate in more detail about that?
Since David's sitting next to me, that's a really good example. David's condition was in such a peculiar location that we had to find different surgeons that were able to get to where his cancer was. So this required speaking to people individually to determine who had the right expertise to actually take care of his cancer. Where he could get the right radiation, that was a big issue in David's case also, because there were certain issues with how he was receiving radiation, and he could better go to one place and not go to another place. The good news for David was that he had a supportive family to take care of his other needs. But we've had other patients not as fortunate as David, where unfortunately we've had to help coordinate getting them into things like hospice care. So my staff, and I would like to acknowledge Tracy Bersis, my administrator, who's sitting there, who helps us arrange a lot of the important things that we do with our patients, getting them from place to place, making sure they get a good appointment, a prompt appointment. So, you know, you go into a doctor's office and you have an abnormal test, and then you have to go and see a specialist. If you go in just by yourself, they say, oh, you can have an appointment next November. That's their next available appointment. But I can assure you, when I call up, you'll be in by Tuesday. So I hope that answers your question.
Yeah. Well, just to follow up with the coordination and having time, very important for the level of care that you give. Was it possible to provide this level of care before Congress established the World Trade Center Health Program?
It was not possible to obtain this degree of care. Initially, we had in 2000 at the end of 2002, 2003, we just had the monitoring program, and it was very frustrating because you could find something wrong with a person, and we really didn't have the resources to make sure they got to see the correct person. And I'm grateful for the Zadroga funding that we have now so that we can do that.
Thank you. For Mr. Howley and Ms. Burnett, can you talk about your care before and after the creation of the Centers of Excellence in the Zadroga 9/11 Health and Compensation Act, and in your view, is it better coordinated?
I was thinking of a story when you just asked the doc a question. I am probably one of her original patients going back to the monitoring program back in 2003. The first time I went there, my blood pressure was basically somewhere off her chart. My sinuses were completely blown out. I had constant infections. I had GERD, which is acid reflux. And she basically refused to let me leave her office unless I went straight to my doctor to get treated for the blood pressure. And I'm 6'3", and she's about 5'1", and I believed her that she wasn't going to let me out of the office. So yeah, there's a big difference as far as, and she's just wonderful, and I'm sure, and I haven't really I've only dealt with one other of the doctors at her office, and I've never been to any other offices, so I can't speak about any of them. But the doctors are just tremendous, and they, as she was saying, when the cancers kept coming back for me, and it's reoccurred 4 times for me, you can now, she can make those phone calls now and get me to the right, and when she says Tuesday, she's not kidding you.
Thank you. Ms. Burnett, would you respond to that, as a patient in the WTC Health Program? Are you satisfied with your access and the care you've received, and compare before and after?
Yes, I'm very satisfied with my care because in 2004, I started blacking out at work, and nobody knew why. And with the regular doctors, I was just being sent out for different kind of tests. In the program, they send me to one doctor who sends me to another doctor to make sure everything is covered. They schedule everything for you, and I think it's very important that they follow up in what's going on, and how they treat us is very well.
Thank you. My time's expired. The Chair recognizes the ranking member, Mr. Green, 5 minutes for questions.
Thank you, Mr. Chairman. Mr. Howley, from your testimony, I understand you've been seeing Dr. Udison since the permanent World Trade Center Health Program was established under Zadroga. Would you explain what being able to see Dr. Udison at the Rutgers Center of Excellence has meant to you? I know it sounded like a little bit from the earlier question.
That's fine. How do I phrase this? Their knowledge that they've acquired because they've seen so many of us, when I present the next set of conditions or a former set of conditions that I had, she can tell me, Dave, go see Dr. X, Y, and Z and not Dr. A, B, and C, because of her knowledge and skill and what she's been able to put together by seeing so many of us. She has that template, those tools in her belt that will send me to the right person.
Do you think you would have been in worse condition without being in the center?
I wouldn't be here. This chair would be filled with somebody else. I would not be here. There were only 3, the last surgery I had last year, there were only, I believe it was 4 surgeons that were qualified to do what I needed to get done.
Okay. Ms. Burnett, from your testimony, I understand you received medical monitoring treatment services through Mount Sinai Clinical Center of Excellence. Could you explain what care you received at Mount Sinai and what it's meant to you?
The care I received have been excellent. They did a open lung biopsy, which determined that which lung disease I had and how they were able to treat it and what doctors I needed to see.
Okay. And could you explain what the care you received at Mount Sinai? I assume it's similar to what Dr. Udison, they're treating the whole person.
Yes, I have a primary doctor. They send me to individual doctors for the different diseases I have, like GERD, asthma, sinusitis, and one primary doctor coordinates all of that.
Okay. Do you think your condition would be worse if you didn't have access to the 9/11 health program?
I believe it would be terribly worse because I had that World Trade Center cough. I was not able to hold a conversation without the program providing me with the medications that I needed.
Dr. Udison, why does this cohort of patients need the types of specialized care that's provided at the clinical centers of excellence?
We have people with rare conditions like David that need specialist help. We've been able to use our best university resources to get people that have seen many abnormalities on things like CAT scans to get patients like the gentleman I mentioned to have the cancer removed. But I think really the the number of conditions that we see and the complicated cases that we see, so you might have one condition and that influences another condition and makes the third condition worse. So if you have mental health issues and you have reflux and then you get chest pain and you have asthma, you end up taking too many medications and then you get a side effect from medications. Many of the asthma medications, if you take too many of them, can precipitate heart disease. So I feel like early recognition and treatment of all the conditions correctly allows for much better outcomes for people.
It sounds like with so many possible illnesses, misdiagnosis would not be uncommon.
Well, that's correct. And Ms. Burnett described her sheer number of conditions. Yes, that is the issue because you don't want to, so you treat one condition really effectively, but you kill the patient while you're doing it because she had some other condition that you ignored. And so that's what I believe we're able to do as the primary care gatekeeper type person. I can make sure that all the specialists are talking to each other and making sure that the total patient is treated correctly.
Thank you, Mr. Chairman. I think because of the complications and the exposure to no telling what, that you need to have someone who looks at the whole person and actually treats all the illnesses that you're subject to. Thank you, Mr. Chairman.
Chair, thanks, gentlemen. I recognize the gentleman from New Jersey, Mr. Lance, 5 minutes for question.
Thank you, Mr. Chairman. Dr. Udison, can you explain in a little more detail your Center of Excellence and what that means and how many there are in the metropolitan region and what qualifies your organization as being a Center of Excellence?
Well, thank you. We're part of the non-FDNY responder program, and so the FDNY has a separate center. We're one of the New York, New Jersey consortium, which includes centers at Mount Sinai, NYU, Stony Brook, Queens College, and Rutgers.
Mount Sinai and NYU would be in Manhattan, and Stony Brook is on Long Island, and Queens is obviously in Queens, and Rutgers.
Queens is sort of in Nassau also. It's kind of on the border over there. And and we serve as a Center of Excellence in New Jersey. What makes us different Our physicians are board certified in primary care specialties, internal medicine, and occupational medicine. It's double board certified. Almost all of our physicians have at least 2 board certifications. As I said, Rutgers has an environmental center of excellence in our same building, and we do extensive work on exposure and health effects. And that happens that's the rest of the faculty that I work with in Rutgers. So we have a lot of experience with exposure and illness. We have a pulmonary doctor that actually comes into our practice and sees patients with us. We have mental health people that come into our practice and see patients. And then across the street from us, we have our surgeons, our gastroenterologists, and a number of other specialists that we need in the Rutgers Center. By the way, we changed our name to Rutgers. We need to get that on the record, that we changed from UMD&J to Rutgers. In any event...
That's because our state legislature has permitted the combination of the University of Medicine and Dentistry and Rutgers.
Right. So in any event, then I have my registered nurses who are there helping us take care of patients, making sure that histories are obtained correctly, making sure that people actually know how to use their medications. This is really very important, that we have people making sure that not only the medications are used, but they're used correctly. Then I have I mentioned my mental health core. Then I have my administrative core, which Tracy Brucese heads, and that group of people is performing audits to make sure that everybody else is doing everything correctly. We're using our pharmacy correctly. We're doing the best that we can to keep costs down using generic drugs, and that all of our providers and people that are writing prescriptions, that everybody is certified, appropriate to do this, and that our patients actually get their medications when they get to the pharmacy. So that's part of coordination of care, and I can assure you we're performing these audits because I want to make sure that we have funding to treat our patients. Presumably, you guys are going to unanimously confirm this bill, and I want the money to be there to treat our patients.
Thank you very much, Doctor. And to Mr. Howley and Ms. Burnett, thank you for your superb public service, and certainly we honor that public service. Ms. Burnett, what position did you play in basketball when you played basketball?
Point guard.
Point guard. I was 5'8", so I never played basketball. Mr. Chairman, I have a letter from, I think, 38 members of the New York and New Jersey delegation to Speaker Boehner and Leader Pelosi requesting early passage of this bill. I would request that it be submitted for the record.
Gentleman seeks unanimous consent to put in the record without objections ordered.
Thank you, and I yield back 7 seconds.
Chair thanks the gentleman. Now recognizes the ranking member of the full committee, Mr. Pallone. 5 minutes for question.
Thank you, Mr. Chairman. Dr. Udison, I wanted to get into try to have you explain, if you will, the importance of not only the Rutgers Center, but all of the centers that are part of this World Trade Program in terms of research, because there is an extensive research component, and I want to kind of emphasize, if you can, how you are developing diagnosis and treatment of disorders that people might not even be aware of, and how that research and the uniqueness of the center makes that possible. Could you just kind of describe how the Rutgers Center is involved in research into World Trade Center related conditions, and how that research is improving our ability to diagnose and treat WTC related health conditions, and the benefits of that research?
So answering the Rutgers only research,
That's fine,
or
sure.
Rutgers and NYU research, is we have a lot of sleep apnea experts in those two centers. And what I'm really proud to say is that between our laboratory toxicologists and our sleep experts, we have developed certain markers that we're seeing in certain of our patients. Dr. Sundaram, one of our sleep experts, presented this at the recent American Thoracic Society meetings, that certain markers were developed that certain people can be predicted possibly to have sleep apnea. And this is really important because these are inflammatory markers, and these people at 9/11 site were exposed to all kinds of toxins that can cause inflammation. And so because of that association between environmental exposures and inflammation, we've been able to find people a lot sooner, get them treated, and for people to think about sleep apnea and the environment, because traditionally sleep apnea was thought of something that you had to be enormously obese to get, and we have patients that are not quite playing point guard, but are in awfully good shape that have sleep apnea, and we're able to as I said, we because of our occupational expertise, sleep apnea is a very serious condition. There was somebody who died recently, a celebrity on the New Jersey Turnpike, because a bus driver fell asleep. And we have a lot of our patients who have to drive commercial vehicles, operate planes, operate the subway, operate all kinds of heavy equipment, and it's really good that we're able to treat them and keep them safe and awake. And I feel like that's one thing our research has accomplished, which is not only applicable to our patients, but it's applicable to other people with environmental exposures.
Let me. I appreciate that. The other thing I wanted to, if you could get across, is how we can expect an increase among the population that of these 9/11 related conditions. In other words, my understanding is as time goes on, we find more cancers, more disorders, as people get older, that that maybe didn't exist before, and that have to be, and that now we're finding through your research or others in these centers that are related to 9/11 that we didn't know about before.
So I want to say that certain kinds of malignancies, hematopoietic malignancies, have very short latency periods, and you'd expect to see something like that within just a couple of years after exposure to toxins. But other toxins like asbestos have much longer latency periods, and they might be seen later on and at a different time. And if I could use just a few minutes to also answer a question that you asked Dr. Howard earlier about mistakes made by providers outside of the program. If I could just add that we have found in the program that people have been undertreated by local providers for various cancers, for various severe lung conditions like pulmonary fibrosis. And I do want to say, even though that wasn't exactly the question you asked, I do want to say that we have been able to improve the health care by toning up, by getting better diagnostic services to our patients than they were able to get from some of the local people.
Thank you very much. Thank you, Mr. Chairman.
Chair, thanks to the gentleman. That concludes the questions of the members. They will have follow-up questions in writing. We will submit to those to you. Ask that you please respond promptly. I would remind members they have 10 business days to submit questions for the record, and they should submit their questions by the close of business on Thursday, June 25th. Thank you very much for sharing your personal experience, for your excellent testimony. The committee will take up this legislation, I assure you, and act on it. And you've performed a public service by being here today. Thank you very much, and without objection, the subcommittee is adjourned.
Thank you.